Infection of the liver of any cause is known as hepatitis. It may be due to viruses, drugs, or alcohol, even though the most common reason is viruses, viral hepatitis. There are numerous kinds of viral hepatitis, the most common of that are hepatitis A, B, and C. Regularly the onset of hepatitis, the intense phase, is not related to signs and symptoms, however when they do occur they are generally popular and encompass fatigue, nausea, reduced appetite, mild fever, or mild belly pain. Later signs more particular for liver ailment may also occur, particularly yellowing of the skin and eyes, jaundice, and darkening of the urine. If the contamination will become chronic, as is the cause with hepatitis B and C, that is, lasting longer than months, the signs and symptoms of chronic liver disorder may also start. Hepatitis A is pretty contagious. It typically is spread from individual to individual through a fecal-oral direction, that means through fecal infection of food. It typically is a mild hepatitis, and many human beings do not recognize they're inflamed. The virus is eliminated through the body rapidly, and it does not reason long-term harm. Hepatitis A is spread from individual to individual through fecal contamination because the virus is present within the stool. It is spread through contaminated food or water through an inflamed person who gets small quantities of stool on his or her hands, does not wash his or her hands, and passes the stool on to food that is eaten by using others. Travelers to nations with high contamination rates and the population of those nations are at higher chance for developing hepatitis A. The Centers for Disorder Managers use travel advisories that discover the nations with outbreaks or endemic hepatitis A. Eating raw foods will increase the danger for hepatitis A. About 5% of people are not capable of put off the hepatitis B virus and increase chronic infection. If a chronically inflamed mother offers birth, 90% of the time her toddler can be inflamed and increase chronic hepatitis B, commonly for life. This will deliver rise to serious complications of liver ailment later in life, such as liver harm, liver failure, and liver cancer. People infected with hepatitis B can pass the virus to others through blood or body fluids. Within the US, the most common manner of becoming inflamed is through unprotected sex, even though sharing an infected individual's needles to inject illicit drugs is also pretty common. Much less common ways are through contaminated razors or toothbrushes. As formerly mentioned, hepatitis B is passed from inflamed mother to toddler in over 90% of cases. Shared needles also are an essential means of spreading hepatitis B. Different risk factors are being a healthcare employee, however contamination typically is related to needle sticks. There is also a risk of becoming inflamed through living with someone who has chronic hepatitis B, in part because of sexual transmission. With acute hepatitis C, the virus is eliminated in 25% of people. The rest of the people become chronically inflamed and later may also increase extreme complications which include liver failure and liver cancer. There's remedy, but, for hepatitis C that typically can prevent the complications. Hepatitis C is transmitted in most cases by infected blood, as an example through sharing needles whilst injecting illicit drugs. The virus is spread much less usually with tattoos or body piercing with an infected needle. Mothers pass the virus to their toddlers at birth, and the toddler will become chronically inflamed. The risk of spreading hepatitis C with unprotected sex is small, however having more than one sex partners, HIV, or rough sex increases the risk. People who've injected illegal drugs even one time or many years formerly could have chronic hepatitis C, and not know it since there are often no signs and symptoms. people with blood transfusions previous to 1992, when they started trying out blood for transfusion for hepatitis C, additionally can also have become chronically infected. Persistent hepatitis slowly assaults the liver over many years without inflicting signs and symptoms. If the infection is not identified and handled, many people will broaden damaged livers. If suspected, viral hepatitis of all types can be identified easily through blood tests.